So NASID is the North American Society for Interventional Thyroidology. So big fancy name, but nice acronym. Um, and so what we're trying to do is for those of us who started performing RFA in the United States, a few of the early adopters, endocrinologists, interventional radiologists, and surgeons have all come together to say, what have our initial experiences been? How do our patients differ from our colleagues in other parts of the world, which is a real consideration because, as you may know, that when we go to insurance companies and we ask the payers to pay for this procedure, they say, look, our patients are not the same as they are in Korea or Italy, so you need to prove it here that it's safe before we're going to, and it's effective before we pay for it. So we're trying to understand what are our experiences so far, what are our challenges, what do we see as things that may impede us from being as successful maybe or as safe even, what are the challenges in education and learning. So NASID is really an effort to get all of the stakeholders together who provide the level of care, who do RFA. Eventually, we foresee including patients, patient advocates, as part of this process. As you know, this is a very early process that we just started. So the bottom line now is getting all of us together to educate ourselves and educate our audiences. So we're doing webinars every quarter. So I did the first one and moderated that with Dr. Kuo in March, but we have another one coming up in June. And it's going to talk a little bit more about advanced techniques. The first one was just simply, you know, how do you use RFA for benign nodules? And we're getting more and more interest from those that are doing RFA, who've done ethanol ablation, and who want to get more involved. So right now, it's just an educational process, but we hope later on it's going to do a number of things where it's going to be educational. It may provide training opportunities. It may provide a forum to discuss research or initiate research projects, or even discuss our, trials and so forth, and maybe have our own sort of meetings. So I think it's exciting to think about what we can do very early in this process. But we realize that interventional radiologists, endocrinologists, and surgeons, we're all thinking about this just maybe a little differently.
Yeah.
And we all benefit from including each other in the educational process to tailor this in the best way possible for our patients. And that's the nice thing. Nobody's trying to box out the other and say only surgeons should do it, only endocrinologists should do it, only interventional radiologists should do it. And I like that. We want to be inclusive. We want good physicians delivering great care, right? That's what we want.
That's awesome. I think that collaboration is always going to yield the best outcome.